Today we have a very interesting video. The things that Medicare doesn't cover. We'll just start right into it because unfortunately Medicare doesn't cover everything for our wonderful seniors who are retired from the workforce. And you'll be surprised actually that most of these things aren't even covered under regular insurance anyway. So it's just more of a public service announcement to let you be aware of things that you thought might have been covered under Medicare, but indeed are not. First, and this is the most obvious one, dental care. Most dental care is not covered under Medicare. As you can see here on this list, there's only about 6 covered services, and most of them tend to do with very, very invasive surgeries that have to be done typically in the hospital. Now for these services, if you get them done, just be aware a lot of times you will be billed separately from the dentist because most dentists don't take Medicare Part B who perform these surgeries. I mean, I can't say that definitively, but from what I have heard anecdotally out in the community, they get billed separately and it's not cheap. So even though Medicare Part B actually covers it, those physicians who they call out to do these surgeries don't take Medicare Part B, so it's kind of a moot point from that point. Next, the most obvious thing I think that people know that Medicare doesn't cover is prescription eyeglasses and eye exams for prescription glasses. Medicare does cover cataract surgery. Medicare covers glaucoma screening. If you have an eye infection, detached retina. Medicare will cover all of those things, but they won't cover glasses. So that's one thing that you have to get supplemental coverage for. On the list, kind of piggybacking on dental care, are dentures, and most times actually your group plan wouldn't cover dentures on the dental plan anyway, which is kind of unfortunate because dentures are something a lot of people need. As they age, teeth tend to decay and we kind of need replacement sometimes. Next thing Medicare doesn't cover is cosmetic surgery. Now that might be a surprise to many of you but Medicare doesn't cover it because it's not medically necessary. There are some very few surgeries like reconstructive surgery that Medicare does cover that's not considered cosmetic surgery, or at least you think of it as cosmetic, but Medicare considers it reconstructive. The best way to know for sure if Medicare will cover it is by unfortunately asking your physician. Actually, maybe not ask your physician, check the Medicare And You guidebooks to see if it does cover it. Do some quick Google searches because I want to say that if the doctor, unless the doctor is known for doing it and does it all the time, they may not know. Their office staff would probably be far more knowledgeable, but still, that's very gray area because many times, especially if you're on that Medicare Advantage stuff, it's going to take a lot more work to get it covered. And I know reconstructive surgery is really important, so just be aware that there is that kind of gray area that you may have to navigate, especially if you're on a Medicare Advantage plan. Next, we have one of my favorites, but unfortunately it's not covered and also not covered probably in most group plans, is massage therapy. Now I like to get massage every so often. I haven't been since we've had COVID, but massage therapy is also not covered under Medicare, so be aware of that. I know some Medicare Advantage plans may offer massage therapy as a benefit, but make sure before you access or take advantage of that benefit that you look to see the fine print, because many times you have to go to an in-network person that has to be authorized, and that can be quite restrictive and also quite tedious. And this is probably the only one that's surprising, is routine physicals. Medicare covers what they call the Medicare Annual Wellness, but they don't cover routine annual physicals. Some, again, Medicare Advantage plans may cover routine physical, but most physicians stray away from that because they're unclear as to which patients on which plans would receive it. So just be on the safe side and do your Medicare annual wellnesses, but don't ever call them physicals, because if the insurance company calls you and you say you've done a physical, then that's not covered under Medicare. So just be aware of that little kind of lingo or verbal kind of change or written change that Medicare has. It's not a physical, it's a wellness visit. Next thing Medicare doesn't cover is hearing aids or hearing tests. Now that kind of sucks because as we age, our hearing goes. I know from playing 6 years of live music, my ears are going. I can barely hear anything anyone says, but yet Medicare doesn't cover it. So that's one other thing that you have to be aware of. Hearing aids are very expensive, but you can get cheap amplifiers if you really need it. Not that I would give any kind of advice to get any kind of hearing aids or hearing amplifiers or anything like that, but Medicare doesn't cover that, so that's something to be aware of. The thing Medicare doesn't cover, and I know this list is pretty long, these are the last two things, and probably the most important things that Medicare doesn't cover is long-term care, custodial care, or convalescent care. I know many people believe that Medicare covers skilled nursing home, and they do, but Medicare covers the skilled nursing part of the nursing home. So as long as you're receiving skilled nursing care, that's pretty much care that is acute care to help you get better or get over a injury or an acute type of illness, that is what Medicare covers. And they typically cover you for anywhere between, I'd say, 3 to 27 days. Once you reach that, probably around day 15 or so, they will start trying to discharge you as fast as they can because of wonderful legislation that was passed to kind of make hospitals and skilled nursing facilities kind of run out of funds during that time. Not that Medicare sucks or anything, just I'm putting it out there that I'm not saying Medicare Part A isn't by any means junk. It's just different. It doesn't cover custodial care. So I know I said that the legislation, all that stuff, it had to be done because if not, Medicare Part A would be obscenely expensive and it wouldn't be free. So just know that it's great insurance, it does what it needs to do, but it doesn't cover convalescent, custodial, or long-term care. You need to get something else for that if you are expecting or hoping that your kind of insurance would pay for custodial care. Now there are a lot of options out there. I'll go into further videos where I talk about the types of long-term care that you can purchase, but as of right now, for now, Medicare Part A doesn't cover long-term care, convalescent care. They just cover you for skilled care, and once you are getting better or you cannot medically get any better from the point you are, even if you can't, walk correctly or, function, live at home by yourself, they still will have to discharge you, and that's just how the skilled nursing benefit on Medicare works. The last thing, and this was added relatively recently, I feel, is Concierge Care or MDVIP, where you pay your doctor a retainer kind of for having you being part of their practice. And this is something that Medicare will probably never ever cover, but the good thing to know is that I have seen secondhand that these types of clinics work really well. So it may be a good investment just for yourself to pay a little bit more per month to visit a doctor who is going to have more time to spend with you. Because at the end of the day, I mean, this insurance stuff, it's set up to pay the doctor to take care of you. If you yourself can pay the doctor to take care of you, that's probably going to be the best way, because then you don't have to work through an intermediary or a middleman. The most important thing that Medicare doesn't cover you for is really yourself. You yourself are probably, this is a tangent, but I'm going into it anyway. You yourself are probably the most risk of your medical journey and on Medicare, because if you don't take care of yourself, if you don't work with your physicians to really help you get better, get to the point where you want to be, if you want to be healthy, if you want to have a vibrant, fit kind of a, the best ways to spend your golden years, your retirement years, then it is going to be that partnership between you, your health, and your doctor that really make that happen. All this insurance stuff is just kind of like a last resort where you should be using it when you need it, not use it because you have it. And that's the point I want to drive through. If you stay to this part of the video, you probably are one of those folks who are thinking very carefully and being very diligent on your care. And I just want to thank you and also compliment you. That is something that a lot of people miss. I speak to a lot of people on a daily basis about their health, and many of them do take that path less traveled. They want to take the natural course. They want to go with the kind of inside out method versus the outside in, take a medication method. And if that's you, thank you. If you want to get on that journey, let me know in the comments and we can go on that journey together. I'll see you guys in the next video.